We are going to discuss types of diabetes mellitus. What is diabetes mellitus? Diabetes mellitus is not a single disease. It is not a single disease but a group of many diseases. Group of many syndrome. Look here. Group of metabolic disease. It is not a single disease but it's a group of metabolic disease. What is the commonest thing about these groups that can lead to hyperglycemia? Look here, chronic hyperglycemia may be present, always present. Okay, there in diabetes there may be deficiency of insulin, either deficiency in insulin or there may be insulin resistance. In some diabetes there may be decrease in insulin, that is deficiency in insulin, as well as insulin resistance that can lead to hyperglycemia. Look here, if there is deficiency of insulin, this is called type 1 diabetes mellitus. Deficiency of insulin leads to type 1 diabetes mellitus, but increase in resistance to the insulin leads to type 2 diabetes mellitus. Deficiency of insulin is caused due to destruction of beta cell. As insulin is produced by beta cell, destruction of beta cell can lead to the deficiency of that insulin. Okay, decrease in insulin production due to beta cell destruction. And the increase in insulin resistance is due to insulin either even more or normal. Okay, now look here, type 1 diabetes mellitus due to destruction of beta cell lead to deficiency of insulin, but type 2 diabetes mellitus is due to resistance to the insulin. Type 1 diabetes mellitus occurs mostly in the children, and type 2 diabetes mellitus occurs mostly in the adult of over 40 years. But if type 1 diabetes mellitus occurs in the adult rather than children, then it is called LADA, latent autoimmune diabetes of adult. And similarly, if type 2 diabetes mellitus occurs in the children, it is called MODY, maturation onset diabetes of youth. Also the secondary diabetes and gestational diabetes are here. What is gestational diabetes? Diabetes in pregnant women is called gestational diabetes. It can be due to both decreased insulin as well as increased insulin resistance. Look here, LADA, latent autoimmune diabetes of adult. Normally type 1 diabetes mellitus occurs in youngster, but if it occurs in adult over 40 years, it is called LADA, latent autoimmune diabetes of adult. Also MODY, maturation onset diabetes of youth. Type 2 diabetes mellitus develops after 40 years mostly, but if it occurs in the children, then it is called maturation onset diabetes of youth. Now secondary diabetes is caused due to other reasons, other causes, which may be either drug induced. Now let's talk about complications of diabetes mellitus. In diabetes mellitus, all the metabolism is disturbed. Okay, it leads to vascular problems, which may be macroangiopathy, problems in the big blood vessels, as well as microangiopathy, small blood vessel. Let's talk about microangiopathy, which is very much common. Microangiopathy. Diabetic microangiopathy is specific to diabetes. It is not present in other disease. Okay, that is occurs only in diabetic patient. But macroangiopathy is not specific to diabetes. It may occur in diabetes as well as other disease. But microangiopathy is specific to diabetes, occurs only in diabetic patient. Diabetic microangiopathy. Capillary basement membrane become very thick. Capillary basement membrane become very thick because proteins are altered due to hyperglycemia. There is non-enzymatic attachment of glucose. As there is increasing glucose level, glucose or glucose product attached to the basement membrane, so that the basement membrane becomes highly thick and it becomes leaky, thick with cracks. So plasma protein leak out from the capillaries. This leads to microangiopathy. These altered proteins are collectively called AGE, advanced glycation end products. What happens initially is that these processes are reversible, but finally this process becomes irreversible. In diabetes mellitus, there is increase in glucose content, that is hyperglycemia. Hyperglycemia. This glucose binds to this glucose as well as glucose product binds to the capillaries basement membrane. This leads to thickening of the basement membrane as well as formation of cracks in the basement membrane, so that there will be leakage of the proteins from the capillaries that leads to microangiopathy. What are common sites for diabetic microangiopathy? There are three common sites for diabetic microangiopathy, which are retina leads to diabetic retinopathy, kidney leads to diabetic nephropathy, and neuron leads to diabetic neuropathy. Okay, diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. These are three common microvascular complications. What happens in diabetic what happens in diabetic retinopathy? Let's discuss. In diabetic retinopathy is the most important cause of blindness in diabetic patient. Most important cause of blindness in diabetic patient. Retinal capillaries thick as well as leaky due to deposition of glucose and glucose products to the basement membrane. Basement membrane thickening occurs, which leads to formation of cracks and leakage of proteins. Proteins leak into the retinal neural tissue and damage it. Leads to microhemorrhage. Retinal vessels are the only vessel in the body that can be seen directly in healthy person. In the early stage, there will be only retinopathy. There will be only what thickening leads to microhemorrhage. But initially there will be no neovascularization present. Okay, neovascularization occurs later. Diabetic proliferative retinopathy. The neovascular tissue is super leaky. Leak lots of inappropriate substance to the neuronal tissue. Let's discuss diabetic nephropathy. Advanced glycation in products leads to the damage of glomeruli in the Bowman's capsule in both kidney. When glomeruli is severely damaged, this leads to end-stage renal disease. Most common cause of end-stage renal disease is diabetes. Let's discuss diabetic neuropathy. Common manifestation is peripheral polyneuropathy, most common in lower limbs. What happens initially is it involves lower limbs. Neurons, sensory as well as motor, undergoes dysfunction. Sensory neuron develops symmetrical problem in both feet. Latter involves hand, called cloves and stacking disease, also contribute to peripheral foot. Diabetes is the most common cause of non-traumatic foot amputation in adults. Because diabetes attack foot in many forms. Sensory neuron damage plus motor neuron damage. Sensory neuron damage leads to loss of awareness, and motor neuron damage, which leads to development of abnormal mechanics of joint and muscle that may produce inappropriate pressure point in the lower limbs, especially in the soles, that causes the damage and ulcer of the legs. Also there will be macrovascular damage. Okay, Let us discuss why hyperglycemia is toxic to body. We know that normal blood glucose level is 79 to 140. Okay, let us say if blood glucose level is 500 mg per dl, then all extracellular fluid ECF becomes hyperosmotic. That is, osmotic concentration of the ECF is greater than that of the plasma. Okay, then it sucks water out of plasma. Then cell becomes dehydrated, and dehydrated cell cannot perform its optimum activity. Then what happens in nephron? If too much glucose is present, then all glucose cannot be reabsorbed. What happens here? Uh, Initially, all the glucose is filtered here. Okay, from proximal convoluted tubule, 100% of glucose is reabsorbed. Okay, some of the glucose is reabsorbed together with sodium by HGLT, sodium glucose transporter, and some of the glucose are transported by solvent drag, that is together with the water. Okay, if glucose concentration is very high, all glucose cannot be reabsorbed, so glucose is lost in the urine, which leads to glycosuria, loss of glucose in urine. Then why there will be polyuria in diabetes? As glucose cannot be reabsorbed, water and so water is not reabsorbed, which leads to diuresis, causing dehydration, so that uh, thirst is increased, that is polydipsia is increased. But when water is not reabsorbed, it leads to increased urine volume, so that it leads to polyuria, increase in frequency of urine as well as increase in quantity of urine, glycosuria, loss of calorie, weight loss, hunger increases due to loss of calorie, which leads to polyphagia. Also, there will be decreased glucose in water reabsorption, as I have told earlier. Filtrate rich in glucose and water, it moves very fast through the nephron. Less absorption of electrolyte, which leads to electrolyte imbalance. Let us discuss here. For example, fish. Fish are moving down the hill. Okay, fish are moving down the stream, and here is monkey, which is watching over the fish and catching the fish. If the rate of flow of water is very high, then the rate of flow of fish is also high, so that the monkey cannot catch the fish. But if the rate of flow of water is low, the rate of flow of fish is also low, so that the monkey can easily catch the fish. Similarly, if there is a high glucose content, there will be high water content, its flow rate is high, so that its reabsorption by is very low, so that loss of glucose in urine will be